Hello, my name is Dr. Love and I'm one of the Hematology Oncology Fellow, and in this video we will talk about transfusion related acute lung injury, which is also named as TRALI. So for suppose a 34-year-old lady who has postpartum hemorrhage admitted to the hospital, she has no history of heart failure, no history of CKD, and she is getting pegged RBC and FFPs. 90 minutes after the transfusion, she complained dyspnea. Her blood pressure goes down, her heart rate goes up, her respiratory rate goes up, oxygen saturation comes down, and then you auscultate the patient chest. You hear bilateral crackles. You order a chest X-ray. In the chest X-ray, bilateral pulmonary diffuse infiltrates are there. However, you don't notice any audible S3 heart sound. You don't notice any JVP, and there is no gallop, no peripheral edema. You order the BNP level and the anti-pro BNP and BNP levels comes normal. So what's your diagnosis? So this is your transfusion related acute lung injury. So how this is different from the TACO? If you remember, in TACO there was high blood pressure, which is very rare in the TRALI. In TACO the pro BNP was high. In the TRALI the pro BNP is normal. In TACO it was responsive to the diuretics, while the TRALI is not. In TACO, you notice the jugular venous distension. In TRALI, there is no JVD there. In TRALI, there is also anti-HLA antibodies positive, while in TACO, it is negative. So let's deep dive into TRALI. Remember, this patient was taking FFP. So FFP or apheresis platelets, these have like anti-HLA antibodies. So these antibodies react against the recipient leukocyte in the lungs, and this is the mechanism of action. So now the question is how you manage these kind of patients. First step, stop the transfusion, notify the blood bank, and put the supplemental oxygen for the low oxygen saturation. If it is not improving, you can go to non-invasive ventilation or invasive ventilation with the low tidal volume. Steroid has no benefit in it, and most of the patient recover within the first few days. This is the most common transfusion reaction which can cause the death.